Senator from Missouri.
Move we suspend the quorum call.
Without objection.
Mr. President, I want to talk for a few minutes today about mental health, a topic that gets lots of attention every time somebody does something that we don't think makes sense, when people do harm to others in ways that we don't seem to be able to rationalize in any other way, but to say almost 100% surety this was a problem that had this person had a significant mental health problem. Now, before I go any further with that idea, I'd want to say that if you have a mental health problem, you're much more likely to be the victim of a crime than you are the perpetrator of a crime. But when we see things happen in schools, when we see things happen, whether it's an elementary school like Sandy Hook or a community college, when we see things happen on a military base like Fort Hood, or just in the last week at a holiday party, there's no way to explain those things except to say that something has gone dramatically wrong in somebody's life. But it does bring us to a topic that we seem to have to be brought to only by the worst of circumstances. 52 years ago, President Kennedy signed the last bill he signed into law, which was the Community Mental Health Act. On the 50th anniversary of that, the last day of October 2013, Senator Stabenow from Michigan and I came to the floor to talk about that. And when you look at the Community Mental Health Act, there were lots of great goals to be set for the country. And, Mr. President, almost none of those goals have been achieved. The goals of closing facilities that people were concerned about, that they thought didn't meet the mental health needs in the best possible way, were often achieved. But replacing those facilities with other places to go and get care didn't happen. And in fact, surprisingly, the worst payer, the worst partner in behavioral health is the government. We've mandated that some of these issues be taken care of by private insurance in what we would consider mental health equity, mental health parity, but seldom have we mandated that the federal government step up and treat behavioral health issues in the same way. And while we've done that, we've largely turned to the law enforcement community in the country and emergency rooms and said, that's our mental health program. Now, the truth is, Mr. President, we've never said that. We've just allowed that to happen. We're the biggest program for dealing with a behavioral health issue is the local police and the emergency room, neither of which are the best place to do this or the right place to do this, though sometimes that's the only option, and understandably so when it's the only option, but it doesn't have to be the only option so much of the time. The National Institute of Health says that 1 out of 4 adult Americans has a diagnosable and almost always treatable behavioral health issue, 1 out of 4. So this is not something that we don't have any relationship with. Now, by the way, they don't say that 1 out of 4 adult Americans has a diagnosis and is undergoing treatment. They just say 1 out of 4 adult Americans has a diagnosable behavioral health issue, and it's almost always treatable. They'd also go on to say, in a hearing we had a year or so ago when I asked this question, that about 1 out of 9 adult Americans has a behavioral health issue that impacts the way they live every day, many times in a dramatic way. Mr. President, we need to do something about this, and the Congress took a big step to do something about it over a year ago when we passed the Excellence in Mental Health Act. And what did the Excellence in Mental Health Act do? The Excellence in Mental Health Act set up a 8-state pilot where in those 8 states, in facilities that met the requirements that the Act specifies, community health centers, federally qualified health centers, community mental health centers that have the right kind of staff, have that staff available 24 hours a day, 7 days a week, and meet other criteria, that in those centers in those 8 states, behavioral health would be treated like all other health. And what I think we'll find out that happens in those 8 states, Mr. President, is that there's no increase in cost. Now, there are a few studies that would lead me to believe that are going on around the country right now. Nobody will argue that if you treat behavioral health like all other health, that the overall societal cost is going to more than pay for whatever you invest in treating that mental health issue. But I think what we're likely to find out, and what studies are beginning to prove, is even with the healthcare space itself, if you treat behavioral health like all other health, your overall health spending doesn't increase, it decreases, because the other issues are so much easier to deal with. If you're taking your medicine, if you're feeling better about yourself, if you're eating better, if you're sleeping better, if you're seeing the doctor, suddenly the cost that was being spent on your diabetes or the cost that was being spent to deal with hypertension all get so much more manageable that your overall cost goes down. And what we think will happen is that 8 states that move in this direction will never go back, even though it's a 2-year pilot. We think all the facts are going to show that it should be a permanent commitment. And in fact, what happened, Mr. President, was that we didn't have just 8-state supply or 10-state supply or even the 20 states that the Senator from Michigan and I were told would be the maximum. If we made this mandatory for the whole country from day one, we might have as many as 20 states that would be willing to participate. But 24 states applied to come up with the framework to hope to be one of the 8 states. And those 24 states have all been given a little planning money. They'll have a few more months to come up with a plan that says, here's what we'd like to try to prove that if you treat behavioral health like all other health, good things happen and it's the right thing to do. Now, the more I talk about that and the more others talk about that, the more I think we all wonder, why would we even think we have to prove this? But these pilot states are going to prove that. I'm beginning to wonder why we don't figure out how to make all 24 states pilot states. A very small commitment leads to a very big result. And what we would find out is that doing the right thing produces the right kind of results. If half the states in the country not only went on this 2-year pilot program, but in finding out that this is really what you need to do, half the states in the country would permanently be on a program that for the first time begins to achieve the goals of the Community Mental Health Act. And there are great discussions going on in both the House and Senate about the Senate bill particularly focuses on how do we expand some of the grant programs that encourage people to go into behavioral health and become behavioral health professionals. The House legislation talks about how do we involve families more in being able to keep up with what's happening with somebody who has a behavioral health challenge. But none of those things actually matter very much if you don't have anywhere to go. You can have all the mental health professionals you can imagine that you'd want to have, but if there's no access point for mental health, it doesn't do you any good to have all the mental health professionals you could imagine you wanted to have. What Excellence in Mental Health does and will do is create that access point where everybody can go. And based largely on the community federally qualified health center model, those expenses are submitted to whoever you might have ability to submit expenses to, the person's insurance company, some of their individual capacity to pay, some co-payment for every visit that is very much part of that system, whatever government program they might apply for, and then the difference is made up for as you submit your legitimate expenses and they're carefully audited And then the goal of the federally qualified center is year after year to get the money back that they've invested in treatment to people that becomes their access point. So I just would like to point out that the access point is what really matters here as the underpinning for everything else. No reason to have a big debate about how you share somebody's records with people who are closest to them if they don't have anywhere to go and get that analysis made. No reason to think about how many mental health professionals we could use in the country if there's no facility for them to go to, for people to go to and meet that mental health professional. So this is a real opportunity. The Congress has agreed to do this. I'm going to be searching, and I hope my colleagues will join me in ways to search to see what we could do to have not just an 8-state pilot for 24 months, but a 24-state pilot, assuming all 24 of those states come back with a credible plan as to how we could meet the goals, not just of the Excellence in Mental Health Act, but frankly, the goals that the country set for itself 50 years ago on the last day of October 1963, and we're still woefully short of meeting the potential that we need to meet to bring people fully into the society based on what happens if you treat their behavioral health issue like you would treat every other single health problem they have. There's no reason not to do that. We have the capacity to do that. We have the ability to do that. We've had the program that the Congress has agreed to do that. And suddenly, the number of states that are taking this seriously exceeded anybody's estimation of the states that would want to be part of this program. I think you could argue, Mr. President, that 50 plus years later, we may have finally come to the moment when everybody's willing to talk about this issue and do something about it. We shouldn't miss the moment. Never too late to do the right thing. We're not doing the right thing now, treating behavioral health like all other health, fully utilizing the skills and potential of people who need just a little more assistance than they currently have to be more fully part of a functioning society than they currently are, is really important. I'm proud that my state, Missouri's always been forward-leaning on these issues, whether it was mental health first aid or trying to involve different kinds of care that works. I hope to see us one of the pilot states, but frankly, I'd like to see every state that wants to do this, that can put a planning grant together that shows that they've made the local investment necessary to prove that they could be part of moving forward with behavioral health to do that. We have 1 or 2 opportunities yet this year. We have the rest of this Congress if we don't get it done this year, but let's not miss the moment for mental health. We're already 50 years behind. Let's not get any further behind when there's a chance to do the right thing for the right reasons at the time we have to do them in. And Mr. President, I would note the absence of a quorum, and
the clerk will call the roll.